Business and safety managers, do you know what to do in the first 30 minutes after a workers' comp injury? Stay tuned to find out.
Welcome to this episode of Increased Profitability Through Strategic Workers' Comp Management with your host, Bonnie Frazier.
There are 3 activities necessary when an employee is injured while working. Get medical care for the injured, secure the site, and get statements from witnesses and supervisors. I'll cover medical care in this session and the other 2 concerns in future sessions. Care for the injured person. Call 911 when necessary. Otherwise, administer appropriate first aid and then take them to the ER or clinic. Try to meet the injured person at the ER if the squad transports them. Once you're at the ER or clinic, help the injured person during intake, adding company information like the policy number. Before treatment, while you're waiting with the injured person, can be a good time to get them to complete the injury report. This can make it easier for the company to get the claim started with the BWC. Post-injury drug test. Pre-injury, you should have an arrangement with the ER or a clinic to administer the post-injury drug test, as long as it's spelled out in your handbook and regulations. Be aware that an injured worker can refuse treatment, but not the drug screen if it's part of your handbook and regulations. Reasonable suspicion. Be sure to record any symptoms or signs if the worker appears to be under the influence of a drug or intoxicant, and ask the testing facility to perform and document a reasonable suspicion drug screen. Bloodshot eyes, coordination difficulties, breath that smells like alcohol, all these could be signs that have a medical cause. A positive, reasonable suspicion drug screen may be sufficient to get the claim disallowed. A routine post-injury positive drug screen is rarely sufficient to get the claim disallowed. Now, imagine how you would like to be treated if you were the employee. Would you want to get dropped off, maybe without your cell phone, your purse, your car? So wait while the employee is treated in case they can't drive themselves after treatment. When they're released from treatment, you can find out when they'll be able to return to work and if they need any accommodations. What you don't want is the employee going to an unknown medical provider and taking time off work without documentation, especially before you can get the drug screen performed. So here are your takeaways. Get appropriate medical care for the injured person. Make sure the employee is tested for drug screening if it's in your handbook and regulations. Treat the injured person as you would like to be treated. And 4th, an independent TPA like ActuComp can advise you during the initial phase of an accident. So call 440-933-6601 to start a conversation about getting the workers' comp monkey off your back.
Thanks for watching Increased Profitability Through Strategic Workers' Comp Management with Bonnie Frazier. For more information, visit actucomp-ohio.com.